This PPD was started in 2011 and was set out to bring regulatory reforms in the health sector, specifically in harmonizing the inspections process in both the private and public space, and especially in ensuring that minimum patient safety standards were adhered to.
We have been involved in the PPP program, of course with the support of IFC World Bank, where we've been looking at measures to improve patient safety. And towards this end, we joined together with the other health regulatory boards, the Nursing Council of Kenya, the Clinical Officers Council, the Laboratory Board, the Pharmacy and Poisons Board, Radiation and Protection Board, and the Nutrition Council, to develop a unified checklist or universal checklist which we use for joint inspections.
The inspections were actually for the private practitioners only, not including the public sector, yet most of the facilities are in the public sector, managed by the government or the faith-based organizations. So we mooted it, we talked to a few private practitioners and they thought it was a good idea. So we decided to hold a meeting where we brainstormed, which culminated in other meetings where we held one very big meeting, and this one was sponsored by IFC. And that's where we agreed to come up with a joint inspection checklist.
What is very unique about the partnership is that at a glance we are able to bring on board people from the private sector, people from the ministry and our development partners to be able to address a common goal and be able to make work easier. And of course, our focus is actually in quality improvement.
We had monthly ministerial stakeholders forum, which we called MSF. And at MSF, we would co-chair with the minister on discussing matters that are very critical in our sector, such as regulatory issues, licensing matters, and just about standards and quality. This forum was very, very well appreciated by the management of ministry, and it was very well appreciated by the members of Kenya Healthcare Federation.
In 2011, we had an agreement called the Naivasha Declaration, which then set the stage for the development of the Joint Health Inspections Checklist. In 2013, we had what we call the Windsor Agreement. Again, this set the stage for the revision of the Joint Health Inspections Checklist, which had been piloted, and again, development of an implementation manual. One major challenge we have met in this process was having strongly opposing positions.
In the beginning, that we were not trusting each other. A meeting called between the regulator and the regulated person was always tense. And whenever they would stand, UMBIA would be very much attentive to hear what does this group want to say, and probably some of the statements were not pleasant.
The way we went around it was to have prior meetings before the larger stakeholder meetings with these strongly opposing parties.
My dream of seeing a joint checklist come into place, I think as we talk now, is a reality. And we want to be the leaders in this, in Africa actually, so that we seem to be doing the same things with a focus for improved quality of healthcare provision.